But first, let's start here. There's been an increase in the number of children under 5 being hospitalised with COVID-19. Health experts believe this may be linked to the Omicron variant. Some are now asking if government should consider putting more effort into vaccinating children. So for more on this, we're now joined by South African Paediatric Association President, Professor Mignon McCulloch. Thank you so much for your time, Prof, and good morning to you. That's certainly the question we would like to hear from you. Should government be placing more focus on young children in terms of vaccinating?
Thank you very much, and thanks for having me on your show. That's the burning question. I think this new Omicron variant has really caused a lot of panic and anxiety amongst parents and healthcare workers. In reality, when you look at the stats, it's 19% of kids under 10 are now presenting with this, but most of the children are still children who are not ill from the disease but actually come in with broken arms or other sort of injuries or issues that require them to go to hospital. We are seeing an increased number of children who may come in with fevers or a bit of diarrhea or even some chest infections or chest problems, and who then are testing positive. The main numbers seem to be in the Gauteng area, and we've been in touch with our colleagues in the big hospitals, so Steve Biko Academic as well as Baragwanath Academic Hospitals in their general peds wards, and they're telling us that the numbers are increasing but the kids are not terribly sick at this stage. Our problem is that this new variant was only identified not even a full 2 weeks ago, and so we are actually watching what's happening, and hindsight is always much easier than foresight.
Right.
What we are suggesting is that everybody gets themselves vaccinated that can be vaccinated. So we've always said the adults and specifically the adolescents now as well. So take your whole family, granny, grandpa, aunt and uncle, mom and dad, but also the teenagers. Go and get yourselves vaccinated. At this time of the year, teenagers want to be out there. They finish school. They want to actually get their lives back again, and so they are also the risky group that actually transmit.
Yeah.
The 5's vaccine, which is approved for them in this country, is not yet approved for kids under the age of 12. It is elsewhere in the world, and I'm sure there will be an application to SAPRA, which is our version of the FDA in the USA. They are vaccinating younger children elsewhere in the world, but we are not quite there yet. And so we're saying in the meantime, get everybody else who can be vaccinated, because that obviously will protect the younger children.
Right.
Also stick to all those measures that everybody knows so well. So mask wearing, sanitizing and social distancing, very hard at Christmas time, because
Right.
everybody wants to be indoors, want to have family lunches. You haven't seen your family possibly for a year or two.
So it could be a difficult time at this moment to social distance, but it is important to do so. Prof, if I could just jump in there. I mean, I want to do a bit of comparison here in terms of those hospitalizations for the under 5 or even the under 10s. Are we seeing more and more of those hospitalizations during this fourth wave under, this Omicron variant than we have previously with the, say, Delta or even the Beta variant? What is the data telling us?
So we've only got one set of data from last Friday from the NICD. So obviously this week will also be interesting to see what happens at the end of this week. So we need time, and our scientists are really working very hard at trying to identify what the characteristics are of this variant. Definitely it seems more contagious than Delta. And Delta was definitely more contagious than Alpha and Beta. So we know that. There seems to be an increased number of children being admitted, but still not children who are filling up the intensive care units. But we need to watch and see what's actually happening with this. So, as I said, and I think if parents are nervous, if they feel that their kids are unwell, parents are the best advocates for their children. If your child is not well, take your child to a healthcare facility, be that a clinic, a GP, your pediatrician. Parents know when their kids are not well, but don't panic about it, because a lot of the children seem to also have quite a mild form of this illness and not critically ill.
All right, well, we'll leave it there, and thank you so much for speaking to us, Professor Mignon McCulloch. Thank you so much for your time this morning.